In this video, we will discuss intermittent IV infusions, or you may have heard of IV Piggyback, or secondary IV is another name for these types of infusions. So these infusions are typically hung every interval that they are ordered. That might be Q6 hours, Q4 hours, Q12 hours, every day maybe even. And sometimes they're hung on the IV pole just by themselves, and as soon as that IV is done, that IV bag, usually they're smaller bags like a 50 or 100 milliliters, as soon as that's done, it's taken down or then the IV's flushed. But sometimes you do have the primary bag, we'd call it. That would be like a 1 liter bag. It could be normal saline, it could be lactated ringers, another fluid. And that's hung up on the IV pole. And then you would hang this little secondary bag on another hook, and you would all run this through your pump. It wires in together and it goes to an IV pump. Now your IV pump is always programmed in milliliters per hour. So essentially when you're trying to figure out what to run the pump at, you're calculating the milliliters per hour. Now the pumps work usually in such a way that you're able to program this intermittent IV bag to run at a certain rate for a certain amount of time, and then it will change back to this primary bag. We aren't going to be going over in this video how to program pumps. The main goal is to focus on our calculations. And so we'll be calculating the milliliters per hour for these sorts of questions. In order to get this answer, you need to always look for two key pieces of information. The main thing is the ordered volume for that patient. So what's the total volume you should be giving? And then the amount of time that you're going to be giving it over. From there, you can find the milliliters per hour. Let's do some examples and see how this works. All right, so our first question is a patient that requires vancomycin, 1 gram, in 100 milliliters of normal saline to infuse over 1 hour. You're supposed to calculate the milliliters per hour for this IV infusion. Now for this sort of question, let's find our key pieces of information. First thing first, let's find our total volume. Here we have 1 gram in 100 milliliters. 100 milliliters is actually the volume that we're going to give this patient. Now you can see that there's 1 gram that is in that 100 milliliters. So the dose that's ordered is the 1 gram, but we already know we have to give the full 100 milliliters to give that amount of medication. So when it comes to intermittent IV infusions, it's best practice to give the whole small bag, and that whole bag should only contain the dose that is ordered. So you need to check what you have available from the pharmacy or wherever the medications are coming from, and you need to make sure that that dose, that 1 gram, is in the 100 milliliters and compare that to the order. But our volume is 100 milliliters, and then when we look at the next piece of information, we need to look at time. This says to infuse over 1 hour. So 100 milliliters in 1 hour. Now, some questions might have other information in them. They may say every 6 hours. I mean, for vancomycin, probably every day that you're going to have that ordered, or every 12 hours. You can ignore that interval when you're doing the milliliters per hour calculation, because you're not giving that medication over the course of the full 12 hours. You are just giving that medication over 1 hour, and then you're going to give it again in 12 hours, and that little bag will be hung up for 1 hour again. So back to our key pieces of information. We have the total volume, which is 100 milliliters, and we're going to give that over the time of 1 hour. Now, as far as the calculation goes, once you've found the key pieces of information, this equation is not necessary to do any more calculations. You can just simplify it to writing it 100 milliliters per hour if you prefer, but you're going to program your pump with that 100 milliliters per hour. All right, let's move on to the next question. Now we have this order, and this one isn't in hours, so there are some calculations that we'll need to do. First thing first, let's read it and find our key pieces of information. So a healthcare provider orders ondansetron 4 milligrams in 50 milliliters of dextrose 5% to infuse over 30 minutes. Calculate the milliliters per hour. We're still looking for the same two key pieces of information. We're looking for the total volume to give. All right, so we have our medication, ondansetron 4 milligrams in 50 milliliters. So we already know if we give the full 50 milliliters, we will give the 4 milligrams that's ordered. So 50 milliliters is our total volume to give. Our total time is over 30 minutes. So we start with our total volume and then we start with our total time. So our total volume to give is 50 milliliters and we are going to give that over 30 minutes. Now, if we just simplified this and did 50 divided by 30, we would get the milliliters per minute, which is not what we want. We're looking for our answer, as I said before, to program the IV pump in milliliters per hour. So we already have milliliters on the top here. If you see this, you see milliliters here, you see milliliters here. So we don't need to convert that top milliliters. We can leave it as is. But the problem here is this minutes. We need it to say hours. If you've watched any of my other videos, you know how to do a time conversion. We can simply multiply by our conversion factor. And we know that 1 hour is always equal to 60 minutes. This will allow us to convert from minutes to hours. And I can just show you how these units cancel here. Minutes cancels minutes, and you're left with milliliters per hour, which is what you want for your final answer. Now you can do the calculations to see what your actual final answer is. You're going to do 50 times 60, which is 3,000. And then you're going to divide that by the bottom, which is 30 times 1, which is 30. And that leaves you with 100 for your final answer. 100 milliliters per hour. So you can see actually we got the same answer as up here, but these orders were written differently. One was written per hour, one was written by minutes. So be mindful of that. If you do have the order given to you in how many minutes, you can always convert from minutes to hours. Let's move on to our final question on this page. A patient needs ceftriaxone 1 gram in 100 milliliters of normal saline to infuse over 30 minutes. Calculate the milliliters per hour for this infusion. Now, I always recommend when you're finding the key pieces of information, if you are a visual learner and that helps you, try to visualize what this would look like. So right now, if you think about what you would have from the pharmacy, you would have this ceftriaxone medication, 1 gram of it, and it would be in a 100 milliliter bag. That's a pretty small bag, and the medication is contained in that liquid, that 100 milliliters. So visualize that, and then think about the amount of time. You're going to hang that up on an IV pole, use an IV pump, and you're going to give it over the course of 30 minutes. So we have our 30 minutes for our total time. Now we can get down to calculating, and we'll start with our total volume, which we're going to give 100 milliliters, and then we're going to give it over 30 minutes. Now there's a few different ways you can do this. Some students go, 30 minutes, I know that's 0.5 of an hour, and then they just simplify 100 divided by 0.5. That's a fine way to do this. As long as you understand, you're basically doing your conversion for minutes to hours in your head. Now, not every student wants to do that or feels comfortable with that method. I suggest you pick a method and stick with it. So we're going to just put our time conversion in here like we do for all of our other questions. We'll do 1 hour, and we know that always equals 60 minutes. Then we can double check to make sure everything cancels, and we see here we have minutes canceling minutes, and we're left with milliliters per hour, which is exactly what we want. Let's do the math. We got 100 times 60, which leaves us with 60,000, or 6,000, sorry. And then we're going to divide that by 30, and that gives us a final answer of 200 milliliters per hour. All right, let's move on to a few more examples. We have a patient that requires gentamicin 80 milligrams in 100 milliliters of normal saline to infuse over 1 hour. Calculate the milliliters per hour for this infusion. Again, let's find our key pieces of information. The biggest problem that I see students having with these sort of questions is that they forget to look for the key pieces of information and they mix them all up and they use them all in their equation. You don't need to use every number that you see in this question. You only need to use the key information for your milliliters per hour calculations. That's total volume and total time. So we see gentamicin, it's in 100 milliliters. That's our total volume. Our total time is over 1 hour. We can then write that out as we would normally. Our order is for 100 milliliters, and we're to give that over 1 hour. This just needs, just can be written again. We don't even have to do any calculations. 100 milliliters per hour is what we'll program our pump with. And let's move on to our final example. Here we have a healthcare provider that orders metronidazole 500 milligrams in 100 milliliters. There's our total volume. That's in the dextrose 5% actual liquid, but we don't need to do anything with that 5%. We know we just need the volume, so 100 milliliters. And that is over 30 minutes. 30 minutes right here. Calculate the milliliters per hour. So let's do that. We have 100 milliliters for our total volume, and we have it over 30 minutes. Now, if we just simplified this, we'd be left with milliliters per minute. We want milliliters per hour, so let's do a time conversion. 60 minutes is always equal to 1 hour, and that will give us our milliliters per hour. We can always double check by canceling the units. Milliliters per hour is left. Perfect. 100 times 60 gives us 6,000, and then we're going to divide that by 30 times 1. And we are left with 200 milliliters per hour. And that is how you do intermittent IV infusion. A lot of the calculations are similar to what you've seen for probably basic IV fluids, but make sure that when you look at these questions, you identify those key pieces of information and don't use or attempt to use extra numbers in your calculation that aren't necessary.